Go get your coffee and join me today on GHC Coffee Break. Joining me will be Dr. Reeves. Get your coffee and we'll be right back.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life and taking charge of your future. If you're ready to be a Take Charger, enroll at Georgia Highlands College today.
Welcome to GHC Coffee Break. I'm glad to have one of my favorite guests, Dr. Reeves, today. We're going to be talking about HIV and AIDS awareness for December.
December is AIDS Awareness Month.
Yeah. And, you know, it's not something I think people have kind of gotten blasé or passé about it.
Yeah, I think you're right. You know, there was a time when everyone wore the ribbons on their collar and that sort of thing. And I think that we have, over time, really put it on the back burner as far as public awareness goes. But it's definitely something that I wanted to talk about today, because as I've watched the whole thing evolve over the years, we have definitely moved to a new era in treatment of not only HIV, but viral diseases in general.
Well, and that's also important about viral diseases. We've seen, I've seen more and more people with viruses and how they attack. You know, we've shared over in the past about a virus that attacked my daughter's heart, and it was just an idiopathic, an unknown virus, and how detrimental viruses can be.
Well, that's true. Viruses are not like bacteria. Bacteria is actually a living organism that has, you know, it's a cellular kind of thing with a nucleus and DNA and all that sort of thing. The viruses are pretty much just encapsulated strands of either DNA or RNA. And how that works, it's really amazing when you stop and look at it. Because you think in terms of a living organism, like, let's say, a person, a mouse, or whatever. You know, it's a multicellular kind of thing that with special parts that do special things. Bacterium have different ways of getting around. They have flagella and things like that can move some of them about. And then there's other ways of mobility as well. Viruses, on the other hand, have to have a host to embed into, and then once they get in there, they sort of like hijack the whole mechanism. And in doing so, then, the main purpose of the virus, after it embeds into a host cell, is to replicate. And when it replicates, then those viruses go out and attach to other cells, and they make more, and they make more, and make more. And so for years, we had absolutely nothing for viruses. We really depended on the body's immune system to fight viruses. And in doing so, we normally were able to fight most of them off. You know, I mean, when you get a cold, that's a virus.
Right.
Okay? And so you run a temperature, and then you may have body aches and pains and that sort of thing. Well, that's because your immune system is gearing up to fight the virus. And as it does, then it gets rid of it. Viruses can affect other things too. They can infect, say, like reptiles or you know, that sort of thing. And so they will actually go out, a cold-blooded reptile will lay on a rock and get warm to raise its temperature to fight off a virus or a bacteria. So viruses are everywhere. But the thing about the AIDS virus is that it did something different. And instead, what it did, when it infected someone, then it actually attacked the cells that normally would attack the virus. So it went to the heart of the body's mechanism to fight off things like that. And as a result, you know, the T cell, a T helper cell, will come in And the virus will, usually what it would happen is that the helper cell would just gobble up the virus. Well, once it gobbles it up, it gets in and embeds in the DNA of that particular cell and replicates. So really, it was hitting at the heart of our defense mechanism. And it took a long time to figure that out. I can remember when I was in medical school, we had just sort of uncovered what the culprit was in this. It started out, but we started seeing opportunistic infections that did not have anything to do with the virus, just things like a lung infection or a particular kind of cancer called Kaposi sarcoma.
Yeah, I remember that one was the big one.
And we never really saw that much of these things, and then all of a sudden, here they are just popping up. And we tried to understand why, and we figured out is because the body's defense mechanisms weren't working. And since they weren't working, why was that? And that led to the discovery of the virus itself. So that once we found out what it was, and since we had nothing to fight viruses, we had to start figuring out ways to attack and fight the virus. And thank goodness we have been able to do that. So what was initially a death sentence is, thank goodness now, has been turned into a chronic illness. We can actually treat HIV, AIDS, HIV in particular, because we don't want it to progress to AIDS.
Right.
That's the autoimmune deficiency virus. So we can now keep the virus actually under a very low profile. In fact, in some cases, we can actually get the virus down to not detectable. But that doesn't mean it's totally gone, just simply means that we aren't able to detect it anymore. So it turned into a chronic disease, one that is now actually manageable.
And that's probably why we don't maybe hear as much.
It's true. That's true. And initially, it was so shocking that we had something that was really threatening everyone when it came right down to it. Because initially, it looked upon as something that was attacking the homosexual community. But then we found that there were other ways of getting this. Most notably, we had blood products that weren't being tested. We had anything that dealt with any kind of bodily fluid the virus could have been in. And so, for example, when I was in medical school, I remember we had one of the world's leading HIV investigators in Macon at the time. And I got a needle stick when I was in doing OB. And at that time, I went to him and I said, what's the chances?
Yeah.
And he gave me all this whole list of things to do, but we really didn't have a whole lot of medications that could be offered. And so I didn't have any medications offered to me for that. But I had to undergo testing, serial testing, because at that time, we could test at the moment to prove that you didn't have it when it happened.
Right.
But then you had to wait about 6 months to be tested again to see if you had gotten infected and had it multiplied in your system. Nowadays, we can test a whole lot quicker, but because the technology has gone so far. And that's one of the advances through all of this, is that we did have a large advancement in our technology and in our skills in treating this because so much attention was placed on it. But like you say, nowadays we don't really think about it that much.
Well, and I think I can remember in the 80s and when I was a student here, and then later when I was working for a Center for Children and Adults with Disabilities, some of the, like you said, the secondary symptomatic problems and things that would occur that we didn't even necessarily relate to HIV and AIDS.
Right.
And the fear, the fear mongering that you could get it from, touching someone, touching their tears.
Right.
And that was the big thing in the 80s, especially that basically being in the same room with the person that had HIV or AIDS, that, oh my gosh, you were going to get it.
Right, right. It was a scary time. And thank goodness we've gone beyond that now. But we still have to take precautions because we do know that it can be transmitted in bodily fluids. So in doing so, we just have to take standard precautions now. And standard precautions actually should have been something we were doing all along anyway, to be honest with you.
Well, yeah, when you think of some of it, and it definitely was a hard transition for me because I worked with children, and some of them had cytomegalovirus. Some of them had, and to find out that, you know, there's different viruses that could be latent at times.
Yes.
And there's times when they're called, if I'm using the term right, sloughed.
Yeah, there is a shedding time for some viruses. For HIV in particular, there's really no basic. I mean, it's always there.
Okay.
Yeah.
But that, you know, that at different times, I guess it's more active.
Some viruses, that's true, especially if you start thinking about things like shingles and that sort of thing.
Okay. It's there, but it's just dormant.
Dormant. And it pops back out when the body's under stress or something like that. HIV, though, is one of those things that the infection is there, and if you are untreated, then you are able to pass that infection along. We now have gotten, like I say, we've now gotten things to the point where we can actually get the viral count, or the viral load as we call it, down so low that we don't really see transmission anymore. One of the things, one of the areas that was always a concern was mothers who had HIV and were pregnant passing it along to their children.
Yes.
And now what we find is that through treatment we can prevent most of the times that transmission. So we've come a long way since the initial days of finding someone with a pneumocystis or Kaposi sarcoma and then realizing that they had an immune deficiency.
Well, and I'm a little bit rusty on mine because, like you said, a lot of things have changed since I took some classes specifically.
Yeah.
I was a first aid trainer.
Me too.
I was a first aid trainer for a while with our center on the precautions, universal precautions, and to getting rid of the fear mongering and the myths about the transmission of HIV. But I lost my train of thought. I hate that. Don't you hate when that happens?
Well, I have a short train.
It's called what? Sometimers. That's another story.
That's a totally different. Yeah, that's a different show.
But looking at again how we've taken the fear, and I think it is getting better. I knew it would come back. Breast milk. You know, the transmission of if there was any transmission from breast milk to the baby.
Right, and like I say, through treatment we have gotten a much better profile on all that, and we're able now to really prevent some of this transmission that we had before. There's even now something that we call pre-exposure prophylaxis, and that is a treatment that let's say that someone is in a relationship with someone who has or has been treated for HIV. Then you can actually get we call it PrEP, a pre-exposure prophylaxis, and that will prevent the transmission of the virus. So in a loving relationship between two people, and one of them has had a history of or has been treated for HIV in the past, there's no reason why they can't still have a normal relationship.
And I know that can be very stressful on a new relationship because,
very much.
I mean, when you look at our social structure today, a lot of people have had prior relationships before getting into a truly committed relationship.
True.
And so that history can be very discerning.
Sure. Sure.
You know, when you're sitting there thinking about, well, here I am going to get into a new relationship. What is this person's history? Do they, have they, should, at what point do I draw the line and say, wait a minute?
Right, right. And basically, it means open communication. You need to have good open communication with your significant other.
And we're going to stop right there and take a break. Go get your coffee, and we'll be right back with GHC Coffee Break.
If you drive buzzed, it could cost you around $10,000. You'll face major legal fees, major fines, and steep insurance penalties. You could lose everything. Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving.
Welcome back to GHC Coffee Break. Thank you for joining us again, Dr. Reeves. I really appreciate it.
Oh, my pleasure.
You know, this is a subject, like I said, I think some of the stigma has changed. I think it's still there. And I don't know if it's just not talked about as much, or maybe we truly don't have as much stigma, which I hope that's true.
I think there's still probably a good bit of stigma about it. And it's unfortunate, but it is something that we should still be concerned about. And I got to tell you that the research into HIV and AIDS has come a long way to help those that aren't infected with HIV, but have other viruses. For example, hepatitis is caused by a virus, okay? We now have medicines that can cure hepatitis C. And that's because of the antiviral work that all began back with the AIDS epidemic. So it, in an odd way, has actually helped to progress our knowledge in medicine to the point where we now have new medications that cure other diseases.
And I think that's, you know, looking at research, and I'm going to kind of, well, let's kind of finish up with the relationships. So it is good to know that it does help with people who have had prior relationships, and that there is a way of having, and you're exactly right, open communication. I think that's really critical.
That's the important part.
Absolutely. And being honest. I mean, especially in a relationship. To me, if you're going to have a relationship, it's got...
You got to be honest about it, because if you're not, what kind of relationship is it built on? It's built on not facts, but fiction.
Yeah, and lack of trust, and we can. That's there's a whole nother show we can do. But along with that, and I'm going to throw. I didn't have a chance to kind of throw this out at you, but there has been. I've taught a bioethics class before, and done some work with organ transplantation. Yeah. And there has been some controversy or some talk about people who have HIV, who want to be organ donors for other HIV recipients. Right. And the latest I understand is that they're still saying no, but you know, people who have HIV and say, look, and there's people on transplant lists that need, regardless of what type of organ, that need organs. Why not? Because a lot of times they won't even sometimes be put on the list because they do have HIV. Well, yeah, right. So why not? And I'm, like I said, I'm really throwing out some bioethical issues, but I like to do that because that's what I like to, I've taught that class, and we really like to have those conversations. But how do you, or can you, as a medical professional, what are your thoughts about that?
Well, it's not as simple of yes or no, not as simple.
Of course not. That's why I asked.
It's an ethical question, yeah. But it's also a scientific question as well. The thing that made HIV so difficult to treat in the very beginning was that it mutated, is that it changed its structure from one patient to another, one area to another. So if we're talking about transplantation of an organ from an HIV infected person who may or may not have been under control, the virus in that particular organ may be different from the virus in the recipient. So it that's one thing. It's not the whole thing, but it's one thing. And then you have to think about, okay, well then we have to keep these organs in a separate system rather than allowing an HIV organ to be transplanted to somebody that does not have HIV.
Right.
So yeah, that's another issue there. So yes, you're right. It is a very difficult question with multifactorial issues involved.
Oh, absolutely.
That make this not a simple yes or no kind of case.
And again, that's one of the reasons why I like to bring it up, because we do know that there are more people on a transplant list than there are donors.
Yeah, and that's why I think people should be donors. To be honest with you, you know, you can check that off on your driver's license. And even if you say, well, no, I'm too sick or whatever, I can't, there's probably still something that can be harvested if you wanted to do that. You know, if nothing else, then eyes, yeah, that sort of thing.
Yeah.
But I'm trying to think about how many people benefit from one organ donor. I think it's 8.
I think that's about right.
Something like that, because the lungs are donatable, the heart's donatable.
Two kidneys.
2 kidneys. You can actually donate skin now. Mm-hmm. They can actually do that.
Eyes.
And eyes. So there's a lot of things that can be donated. So people could benefit from that. But there's not as many donors as we have people who need the donations.
And that's where, you know, in one of our, I think it's bioethical issues, I want to say it came up in one of our stories or our cases.
Yeah.
And it was talking about that, you know, people who have HIV
mm-hmm.
who are on the transplant list, or would like to be, or maybe would like to be on it. Because I think, if I'm not mistaken, it's almost impossible to be put on the transplant list because they have HIV.
Mm.
I don't quote me on that, anybody, because I haven't done that research in a while. But so, and then there are people who have HIV that said, well, why can't I be a donor for people with HIV? So that, but you know, I did not know about that medical piece of it.
Yeah. And that makes it difficult, because then you may be introducing...
Difficult, but not impossible.
Not impossible, but then you may be introducing a strain of virus that could become deadly for the recipient. And that's the issue.
But are they not going to die if they don't get the transplant?
Well, there you go, too. Yeah, you're exactly right. So it's nothing like this, no decision like this is simple, straightforward, cut and dried, black and white.
I totally, and again, that's the kind of, and that's why I like to have those kind of discussions in class, and especially from students with non-medical backgrounds.
Right.
Because it does really get them to thinking. They don't know this little piece that you and I just discussed. I try to get them to look at it from a humanistic point.
Sure.
Because
and humanistically, you say, yes, why not?
Right.
You know, I mean, I think that's where most of us would fall on that, would be, sure, let's go ahead and do that. Sure, you could transplant from a non-HIV person into an HIV person. You can certainly do that. And if they have been treated to the point where this is a chronic disease, I don't see why that would not be an issue.
Yeah, chronic as opposed to, you know,
as opposed to an active or acute kind of,
right.
Yeah. Because it's still one of those things that HIV really never ever kills anybody.
It goes into the
It's
AIDS.
the infection that does it.
Okay.
Like I say, the thing that HIV does is it attacks the immune system. And if you lower the immune system enough, then any kind of infection, viral, bacterial, fungal, I mean, doesn't matter, is able then to become deadly.
Yes.
So, I mean, I could recount several different cases of HIV patients that I had back in the early 90s that it was pitiful, and because we didn't have the medicines that we do now. Mm-hmm. So you wind up treating things, but you're not being able to treat them as well as you could. Nowadays, it's totally different. And as I said, thank goodness we have made this from an acute death sentence to a chronic condition.
Well, which is that's I think that's really good news. We have about 3 minutes left in our show, so I would like
I
to.
could talk longer than that.
Oh yeah, me and you both, because we're very passionate about what we talk about. But what can we do to help dispel some myths, some stigma, to help our viewing audience not be afraid, but be cautious, to not be stupid, but not be afraid of just because someone has HIV?
Well, I think we all have become somewhat more relaxed about the issue, and that's probably because we haven't heard a lot about it on the news and that sort of thing.
Yeah,
I
it's
think we have
definitely not
become
as-
relaxed about it. I think as far as medical workers go, we all are always concerned about infections.
any kind.
Well, yeah, of any kind. And that's an issue that we continue to be concerned about. But the transmission rate and that sort of thing has dropped drastically because of our medications and awareness.
Yeah,
I think
people
are
taking
much-
care of their business.
Exactly, much more aware than what they used to be. And so we have made great strides, but I want people to continue to think about it because it's still there. And it's still something in the background. And we still are doing research on ways to attack and take care of this particular problem. So during AIDS Awareness Month, I would like to invite people to donate to AIDS Awareness. There's several different agencies. We have a group here in Rome, actually,
Yes, sir.
that helps with AIDS patients and families of AIDS patients. So look them up and give them a call and see how you can pitch in and help out. I'm president of the Free Clinic, and so we have worked with them in the past with patients that needed that kind of assistance. And we will continue to do that because this is a disease that needs special attention. It needs more research. And we don't need to banish these people.
Right.
In the initial times of it, to me, it always reminded me of sort of like a leper colony.
Yeah,
they wanted to banish
or Typhoid
people.
Mary.
Yeah,
that
but
kind of.
they just wanted to push them to the side and say, have special clinics for them, and just I don't want to hear about it anymore. Let's don't do that anymore.
Yeah, and I think that's the key, and that's the message we want to get across is people are people. We take precautions, but by me hugging you, touching you, I'm not going to get it.
Exactly.
Don't share needles.
No, please don't.
And don't have unprotected sex.
There you go.
And don't get, and we are very unlikely to get tainted blood nowadays. So.
Oh yeah, that's not an issue
Yeah.
anymore.
So, and get your coffee, and we'll be right back with GHC Coffee Break.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life and taking charge of your future. If you're ready to be a Take Charger, enroll at Georgia Highlands College today.
Welcome back to GHC Coffee Break. I really, as always, enjoy having you as a guest. You make my job easy.
Well, I enjoy being here and talking about important things with you.
Exactly. So I know that we want to leave the take home we'd like to leave everybody with is stop the stigma, be aware, stop being afraid, but also make sure you're using precautions and protecting yourself. And until next time on GHC Coffee Break, we'll see you next time. Have a good day.